Welcome to the Economic Development Council's Vision of Progress. I'm your host, Nathan Sparks, and today we're talking with David Fuller, CEO of North Okaloosa Medical Center. David, welcome to the show.
Thank you, Nathan. Glad to be here.
We appreciate it. So you've been with North Okaloosa Medical Center for about 4 years now, if memory serves. There are probably some folks in our viewing audience who you haven't had the opportunity to meet. So if you don't mind, would you mind giving us a little bit of David Fuller's background?
Sure, absolutely. Well, I mean, my wife would be upset with me if I didn't start there first.
Sure.
Wife and have 4 sons. It's hard to believe that my oldest is now 30 and the youngest is 19. It's amazing to me how they're able to get older, and I don't seem to get that way, or at least that's the way I like to think anyway.
Right.
But married, have 4 sons. Been with actually the company that operates North Okaloosa Medical Center, Community Health System. Been with them now 15 years. It's kind of hard to believe. You know, they say time flies when you're having fun.
Sure.
I would argue it probably flies when you're not having fun too.
Right.
But we have a good time up at our place, and I feel really comfortable in the community. Having grown up in South Mississippi, I joke a lot of times with folks that if you didn't make a little trip down to the Florida Panhandle during some time when you were in high school and college, you didn't get a full education.
Right.
And so this was a little bit like coming home, because I'm only a few hours away from where my parents are located now, and so we really enjoy that convenience as well.
I can relate to that. So let me ask you, what was it that attracted you to the opportunity at North Okaloosa Medical?
Well, I mean, Nathan, we live in a kind of an exciting community, particularly when you look across of what would been traditionally be known as rural communities in America. You know, Crestview is kind of a quasi-rural, non-urban sort of area, and we've got a real tremendous business opportunity. I think there's a collection of really capable providers up in that area, and being a part of that and being able to grow and expand the service offerings that are available in our area, commensurate with the growth of the community and its needs. So we were just really excited to be able to come down and be a part of that continued growth.
Absolutely. Well, let's see. So North Okaloosa Medical Center, 110-bed facility, if memory serves, over 600 healthcare professionals employed up there. That's a lot to keep track of. How do you do it?
Well, we got a lot of help, first of all.
Right.
And we got a lot of good people working for us.
Sure.
One of the things we try very hard as an organization is to try to be as transparent in today's, and sometimes I hesitate using that word because transparency is such a buzzword in today's business world, but try to be as transparent with our team members and our community medical staff, and all of them working together to try to be responsive to what is our patients and what most businesses would refer to as customers' needs.
Right.
We're really focused a lot on keeping our patients safe and providing a high quality service. So all that group working together does, I think, an outstanding job for our community.
Right. From what I've seen, I would agree. We actually had a good friend who unfortunately had a medical issue. You remember this. He was in town visiting, and he said that the hospital experience that he had up at North Okaloosa Medical was the best hospital experience that he had ever had.
Yeah, and I'd like to pay him for that, for that compliment. No, we try very hard to bring personal touch. One thing I really enjoy about communities like Crestview is, you're not just an institution that very rarely has a chance to interact with individuals that you know. You're very liable to see the people we take care of at the church, at the school, out if you're in the community buying groceries, and they don't mind holding you accountable. They don't mind telling you, hey, this is not going quite the way, or something didn't go quite the way that they would have liked for it to.
Right.
But by the same token, they'll also give you an attaboy every once in a while when you do things right.
Absolutely.
So we like that personal touch.
No doubt about it. Well, let's see. I'm interviewing a hospital CEO. It's almost obligatory that I ask you about the Affordable Care Act. It's hard to believe that it's been almost 4 years, or perhaps more than 4 years, since that law was initially signed, and obviously there are parts of it that are being phased in over time. But if you could comment a little bit about how the Affordable Care Law is as hotly debated as it's been, how it's changed the day-to-day operations of your hospital.
Well, as an organized institutional provider, anytime that we can have individuals in our community gain access to benefits that they previously didn't have, that's a good thing. Now, we here in the state of Florida kind of have a mixed bag of things because of the fact that we chose not to participate in some of the Medicaid expansion elements. But as far as our operations day to day, we are beginning to see a few people that heretofore maybe didn't have benefits to have some benefits, which removes a major obstacle as people consider health care. And unfortunately, in the absence of coverage, people will put off, and unfortunately with medicine you put off, and things aren't going to heal themselves more times than not. Some type of intervention is required. So we are beginning to see some more people with some coverage. The unfortunate part about it is most people think there's some magic wand and all of a sudden there's a new program. As you alluded to, Nathan, things are phasing in, bits and pieces here and there, the employer mandate, the individual mandate, and all those pieces really kind of make it really complicated to know what's going on, and particularly in an area like ours where the closest exchanges are in Pensacola. We don't have the actual health exchanges operating in our area that people can reach directly out to and touch. So it's provided some unique challenges for us, but I'm excited about where I think it can go with continued vigilance on the part of everybody who's in the system.
So the flip side of that, if you were king for a day, David, and don't get excited here, this is just imaginary, but if you were king for a day, what would you change about it?
Make it simpler for people.
Okay.
I think there's a lot of confusion about parts and pieces. I wish we could address some of the cost pieces, particularly as it relates to benefits. A lot of people have gone out and looked at what's available and realized with their budgets, maybe they can't afford that premium.
Right.
So between simplifying it a little bit for John Q. Public and then looking at some ways that we can make the benefit programs a little more cost economical for the average working Joe. If I were that king for a day, I'd try to figure out some ways to make that simpler, maybe a little bit more cost economical for the normal household budget.
Sure, understood. So let's shift gears a little bit. A few months ago, I noted that North Okaloosa Medical Center was recognized as a top performer by the Joint Commission, which I understand is a prestigious body that oversees hospitals like yours. Can you talk to us about the importance of that recognition as a top performer? And specifically, first and foremost, for those out there in our audience, what does that mean?
First of all, the Joint Commission is a national accrediting body that's organized and exists in Chicago.
Right.
They certify and accredit organizations across the country. I always describe it to folks, it's kind of like the good housekeeping seal of approval for institutional healthcare providers. But at the same time, they establish a standard of operation so that across the country, whether you're in a hospital in Crestview or Fort Walton Beach or Timbuktu for that matter, that you know that you're going to get a consistent level of service in all those organizations. As far as their recent identification as a top quality performer, that's something I'm personally kind of a little proud of, Nathan. We've, in recent times, talking about money a few moments ago with the Affordable Care Act, there's been a real push in our industry to talk about the value of what you get when you purchase health care and making sure that the clinical outcomes are what they should be. Patients not being readmitted to the hospital, or certain procedures that have been proved by evidence that are the way that medicine should be delivered. We've made some significant progress over the last 4 years when you look at the data, the raw statistical information as we compare ourselves to other hospitals of our size and type across the country. And that recognition you alluded to is that these hospitals are performing at top tier performance, and we were real thrilled about the ability to get that recognition. But you know what, the recognition that really kind of means more to me than even that, and that's national recognition, is that for 3 years in a row now, we've been identified as one of the finest hospitals on the Emerald Coast by the readers of the local paper. So that's the customers, to me, ratification of what we're doing is good. We're not perfect by any stretch of the imagination, and we're going to make mistakes, but I think it's important that we remedy those mistakes when they occur, whether they be a customer satisfaction concern or even a clinical concern. And we're committed to doing that every day.
So when you, and you've had the good fortune of being named finest on the Emerald Coast, as you mentioned, being recognized by this national group, when you do those things, I'm sure, knowing you're the type of person who makes certain to thank your team, and I wouldn't be surprised if you guys don't have a celebration when you have. Oh,
absolutely. Well, hospital people are always looking for an excuse for a party, whether it be a reception or some kind of function. And you're right, Nathan, we were talking about earlier about management and leadership. It's all about the people. It's all about those nurses on those units, those technicians in those labs and those x-ray departments that are out there every day touching people. I envy them sometimes because they get the ability to have direct contact every day, all the time.
And they wear scrubs.
And they get to wear scrubs instead of coats and ties.
Well, North Okaloosa Medical and North Okaloosa, the futures of the two are intertwined. And North Okaloosa obviously continues to experience growth. We're talking about the geographic area of North Okaloosa County. Truly phenomenal growth in the northern part of the county the past decade plus. And I know that you all have been cognizant of that. You've planned accordingly. You've invested in hiring new talent, in physician specializations, and you've also invested in facilities. Let's talk a little bit about the physician element of it. As I understand, the North Okaloosa Physicians Group has added specializations and continues to add specializations. What are some of those specializations that folks may be surprised to hear are available in North Okaloosa County?
Well, and I've jokingly said in the past that a hospital is nothing more than a really inefficient warehouse without our medical staff.
Right.
You know, that's what drives the organization
Sure.
and the quality and caliber of medicine. And we've been very fortunate over the last several years to add to that team, as it were, the bench strength that we need to be able to be successful. Everything from general surgery to orthopedics. Our most recent addition is gastroenterology. All of those specialties are there because the community, as to your point, as it's grown and there's a need for more services, you can add these things and keep exponentially growing. But at the end of the day, probably the single most important players on the mix are those primary care physicians, those internal medicine docs, those family medicine docs that are out there in those clinics every day taking care of folks. These people I refer to in the specialties, like your orthopedics and general surgery and gastroenterology, those are support players for what those guys are doing. So it's a team of people working very hard to be able to provide the kind of medical care that's needed in our community. And the beauty is, like I said, with that growth, population growth and expansion, you can bring more and more and more medical specialties to prevent people from having to travel distances. Right. It allows us to reinvest in the healthcare delivery system in our community.
Absolutely. Well, David, on that point, are there specialties that you would like to grow in North Okaloosa Medical that you have your eye on? Oh,
absolutely. Of course, we're always looking to grow our primary care base because
right.
those are the guys. Because people hate to think about this, but people retire or choose to practice in a different way than what they may have 10 years ago. So you always need to build that. Right now, we're spending a lot of time and looking to how we can expand pulmonology. Respiratory issues are a big thing in the South in particular.
Right.
Congestive heart failure and COPD are conditions that our folks routinely suffer from. We need additional pulmonology coverage to be able to support their needs. We're also looking at urology. We've had the support of a longtime urologist in our community who's done a great job for us.
Right.
But we need more. And we're excited about the prospects of what we can find to bring services to our community.
Absolutely. Well, it would stand to reason, and correct me if I'm wrong, but this beautiful place we call home in Okaloosa County has to be a bit of an advantage in pursuing physicians around the country and beyond. Do you find that to be the case, and are there other qualitative things that come into play as you're undertaking the physician recruitment process?
Absolutely. We spend a lot of time analyzing the population, as you might expect,
right.
To identify specific specialties and specific needs. But then after we identify those and we start out into the marketplace, as it were, to find the right kind of players, we talk about a community like ours. Now, if you compare us to Atlanta or, Orlando or Tampa,
right.
we don't have some of the things that they have to offer. But what I can kind of sell to physicians as we're talking about prospects in our community is a sense of community. I tell them all the time, if you're looking for the opera or the Museum of Art, probably going to have a hard time finding one of those in Crestview.
Right.
But if you're looking for a great place to live and a great place to raise a family and in really close proximity to a lot of cool stuff, we're your place. And it does play to our advantage tremendously that you can have this kind of quiet home personal lifestyle and at the same time be in close proximity to a lot of really nice features and attributes.
Excellent point. Excellent point. David, we're going to take a short break. We've been talking with David Fuller, CEO of North Okaloosa Medical Center, and we'll be right back.
When this hospital system needs to manage the care and information of nearly 1 million patients, Cox Business is there. When experts a world apart are needed in one place, we're there. And when visits need to happen well after visiting hours, we're there too. With a $16 billion network, Cox Business powers healthcare. We're there for your business too.
Take a stake in your community and join the Boys and Girls Club of the Emerald Coast for the inaugural Steak and Steak Dinner on Thursday, September 25th at the Emerald Coast Convention Center on Okaloosa Island. The event allows the community to meet the club's youth and see how their lives have been impacted by the Boys and Girls Club. Special guest speaker Jim the Rookie Morris will also share his story that led to the popular movie. For more information or to get tickets, call 862-1616 or visit www.bgcec.com.
Our commitment to the community is something that we believe in and act on every single day. It's a key part of our culture and who we are as a company.
Cox donates millions of dollars in cash and in-kind services to support local nonprofit and civic organizations each year. We recognize that a healthy community is a growing community. Here's a look at just a few of the organizations we support right here in Northwest Florida.
We're extremely proud of all these local partnerships.
Together, we are working to make the Gulf Coast thrive.
Welcome back to the Economic Development Council's Visions of Progress. I'm your host, Nathan Sparks, and today we're talking with David Fuller, CEO of North Okaloosa Medical Center. And when we left off at the break, David, we were talking about talent. But I also know that North Okaloosa Medical Center has made an investment in growing your service lines and improving and growing into different areas such as robotics. Can you talk to us about some of what you all are doing to expand your service lines up at the hospital?
Absolutely. As a matter of fact, before I get to robotics, because that's always fancy.
Yeah, right.
Let me spend a moment talking about a couple other programs we're
Sure,
real proud
yeah.
of. We, on July the 14th, had a visit from the folks that are the Chest Pain Center accreditation body.
Okay.
And they look at how we manage our interventional cardiology program and our heart cath program, and that entire interventional component. And of course, we've been committed to that program now for 2 years, and the Chest Pain Center accreditation is in the process. The inspectors tell us that we can expect an affirmative decision on our behalf, and so we're real excited about that. And you can be assured, as quick as that national accrediting body comes out and tells us it's official, we'll be tooting our horn and making the community aware of that. It's ironic, I was talking to a physician this morning who made the comment that one of his patients had gotten some cardiac treatment in Pensacola. And while he was talking to him about it, he said, you know, we can do that here now. And even though we've been in this program about 3 years and got some great support from some really outstanding cardiologists in Okaloosa Cardiology, Okaloosa Heart and Vascular, I'm going to get their name right. But we've just been really pleased with how that program's going. But it's still a struggle getting the word out sometimes,
right?
You know, to folks about what you're doing. But so we're going to have a nationally recognized program in interventional cardiology.
That's fantastic.
Absolutely, it's exciting. And my hat's off to my staff who've worked, you know, tirelessly, literally, getting everything ready for that site visit. Back in January of this year, we began a wound care center, and what's exciting about that is it sounds kind of basic in its service offerings, but as a part of that whole center, we offer hyperbaric treatment for wounds.
Help me with that, David. What is hyperbaric treatment?
Hyperbaric, so that's the same treatment that they use to treat a diver who gets the bends. You put them in an oxygen concentrated environment.
Okay, that's where I've heard of that.
Yeah. But actually what it does is allows to enrich the tissues with oxygen and promotes wound healing. It's really kind of surprising, Nathan, that there's a lot of folks out there that you might see that suffer from chronic wounds. And they go about their lives just kind of in silent suffering because you don't see it.
Right.
They keep it hidden or kind of covered.
Right.
And so by having this program, getting them in, proactively treating those wounds, and then proactively qualifying them to go into those hyperbaric chambers, we've seen some really dramatic results, and people that have been suffering for quite some time with problems, getting those problems addressed. And the last item that you referred to, we're really excited about, we're actually in the initial phases right now. Most everybody has heard of robotic surgery,
right,
or robotic assisted surgery. The robots don't do the surgery, but it's a tool that our surgeons can use to create a minimally invasive experience for our patient. And we're really excited. We currently have 3 physicians who are in various phases of deploying that element to their practice. And the results that we've had so far have been real exciting. But the most exciting when we're talking about outcomes is the fact that a patient could come in this morning, have what we might have traditionally referred to as a major surgical procedure, and be talking about going home before the sun sets. And that's amazing.
Unbelievable.
And the recovery and all the issues that go along that patients have post-operatively, the soreness and the pain and the discomfort, is minimized dramatically with the use of this technology. We're excited.
That's tremendous. Right here in Okaloosa County.
Yeah. Well, and we're not the only provider of that
Right.
service in the county. I mean, our friends down at Fort Walton Beach provide that as
Right.
well. But we're real excited about being able to offer that to the citizens of the northern part of the county.
Absolutely, absolutely, and we're excited for you. So you all are growing talent. You're expanding your physician specializations. You've added service lines. And you've also improved your facilities and added new facility space. In fact, my recollection is that in 2010 you all had a pretty significant expansion that our Economic Development Council was very pleased to assist with. Talk to us a little bit about that. Remind us of what that was all about.
Well, our facilities have gone through multiple iterations through the years, expansion of ED, expansion of OB departments, and on. This is probably the single, it wasn't probably, it is indeed the single largest addition that we've done to the facilities since its original construction. It was an intensive care unit and step-down unit. And most folks probably understand that when you come into a hospital, if you're acutely ill, you end up in an intensive care unit maybe for 2 to 3 days. And then they gradually reduce back the care. That's the step-down unit.
Right.
You go there for a short period of time. And you know you're getting better when they want to put you on a regular med-surg unit because your condition has improved to the point that no longer needs that intensity of service. The expansion that we did was that of an ICU, new ICU facilities, an 18-bed unit that's really pretty much state-of-the-art from the standpoint of size of the facilities, monitoring equipment, and everything else. And then that step-down unit is very comparable as far as its technology and state-of-the-art. And so, we were able to add that because of the support of our community.
Right.
And we appreciate that support. And the further acknowledgement of that support came through some of the things that we've talked about previously in some of our EDC meetings and the ad valorem tax efforts that the communities had. That was a helper to us in deciding, does this community really support, do they really feel like they want to get behind this initiative? Lots of times when you're looking at a business decision to make, you feel good about it based upon your analysis.
Right.
But that last little piece that says, yeah, this is the deal to do, sometimes you kind of struggle for. And having the support of the community behind you in those kind of efforts really kind of pushes that over and makes it an easy decision to make.
You're absolutely right, and I see that all the time with economic development deals where, obviously incentives are sweeteners that can tip the scale and ultimately get a decision made. And sometimes we're not talking about big dollars, but we're talking about a statement of good faith, a show of good faith on behalf of that community that, hey, we believe in you and we want to partner with you.
Oh, absolutely.
And you mentioned the ad valorem tax exemption program, which is obviously something that we want to talk about, given that we have the upcoming vote on August 26th. Based on what you've shared with me both today and privately, that did play a role in your decision, your corporate decision to expand for the reasons you've mentioned. Obviously it wasn't big dollars, but it showed that the community was committed as a partner. And as far as that tax exemption program goes, I want our viewers to understand that we're at a crossroads in this community. Truly, we've had this tax exemption program in place for high-wage jobs for the past 10 years, and it's provided for under our state constitution. Every 10 years, you as voters in Okaloosa County have the opportunity to go back to the polls and re-endorse through referendum that ad valorem tax exemption program. And so on August 26th, or earlier if you choose to early vote, which could start as early as August 11th, you'll have the opportunity to go and renew this commitment to job creation in Okaloosa County. Just a little bit about the program. Over the past 10 years, along with David's company organization, there have been 4 other businesses who've benefited from this program. So you can say that the county has been very judicious in awarding the tax exemption program, the tax incentive for companies creating new jobs. Obviously, there are qualifying criteria as provided for under our state constitution. Companies have to create a minimum number of jobs at a wage level that is at least 110% of our county's average wage. And that's a key point because obviously focusing on those organizations that are going to hire people at wages that are higher than what might be out there at present is where really the rubber meets the road. That's how we move this economy forward. So I would encourage all of you to learn more about the referendum coming up here in a couple of weeks and to study the issue. We know that our competition has the tool in place, and this is really, frankly, folks, about keeping Okaloosa County competitive for job creation. We know that we're competing not only with our neighbors in Walton County and Escambia and Bay County. By the way, all those counties have the program in place, but we're competing, frankly, with other states and beyond. We're now competing with the world, and we need every chance we can possibly muster to put forth a competitive package to ensure that Okaloosa County can prevail in job creation decisions. So thank you for considering that. I wanted to take the opportunity to remind our voters of the upcoming election. Thank you for allowing me that opportunity, David.
You're welcome, Nathan.
So as far as we've talked a lot about your current efforts, things that you've been doing over the past 4 years since you've joined the organization there at North Okaloosa Medical Center. So what does the future look like? Looking out, 2014 and beyond, where do you see the hospital going? Obviously the northern part of the county is going to continue to grow, and I would anticipate that you all are continuing to plan for growth as a result of that. But is that a safe assumption?
Oh, absolutely. I routinely describe to our staff and others that visit our organization that I feel like we're standing on a precipice, and that precipice is not a bad thing, as it might suggest, but almost the sky's the limit as far as what it is we want to try to accomplish. I mean, from a standpoint of our business, we're constantly looking, like we talked already, about medical specialties and facilities and equipment. What's the right thing at the right time to add? But as our community continues to grow, and we continue to get the support of the community, as I said earlier, we don't do everything perfect,
right.
But we are committed to trying to do the right thing in almost every case. And as those opportunities present to us, I feel positioned to be able to respond in a positive way. Now, quite honestly, in healthcare, if somebody sits back and says, "I'm going to tell you what we're going to do in 5 years or 10 years," well, they're probably stretching it a bit, because with the way the landscape's moving and changing, it's hard to predict too far. But I'm excited, sincerely, and feel like we can be whatever we want to be and whatever our community needs of us.
Absolutely. I'm going to ask you in our closing question here, David, I'm going to ask you to take off your CEO of North Okaloosa Medical Center hat and put on your Economic Development Council Executive Committee member hat. What do you think about the future of Okaloosa County?
Nathan, I'm just as excited about it as I'm excited as for my organization. You mentioned the ad valorem tax issue a few moments ago, Nathan. I think one thing that people need to realize is, what we're doing from a standpoint of incentives there is not going to change the world.
Right.
What it's going to do is keep us on the playing field, keep us out there with those folks that are looking for opportunities and places to grow their business. But I think we've been very blessed. Geographically, we've been blessed with a solid workforce and population of folks. And I think as long as we continue to stay vigilant every day,
right.
supporting the EDC, supporting the cities and the county as they try to move forward, prodding them when we need to,
right.
supporting them when we feel it's appropriate, that I think the future is very exciting for us.
Well, and I agree with you wholeheartedly. And David, I've enjoyed visiting with you today. Thank you for coming on the show.
Thank you, Nate.
I'd like to remind our viewers that the Economic Development Council is hosting a roundtable on August 19th. Our roundtable breakfasts are a great opportunity to come and learn about key drivers of the Okaloosa County economy. In celebration of the EDC's 25th anniversary this year, we've been holding a series every quarter. This one will focus on entrepreneurship. And we have some exciting speakers coming in from Miami as well as Orlando, ladies who are going to speak to incubator opportunities as well as angel investor opportunities that we can harness in order to really grow more small business in this economy, because we all know how important that is to our future. So thank you for watching our show today. We appreciate it very much, and thank you for your support of the Economic Development Council.